First of all, I would like to thank you, the organizer, to invite me to give this talk. I prepare my slides in English, but I recognize there's some people suggest I give my talk in Chinese. No, okay. So the topic is let me open my topic is involving epidemiology of cardiovascular disease in China. I'm talking a little bit not only the disease involving, but also the display in China, how we build up the capacity to do the epidemiology study. So that we know the epidemiology, cardiovascular disease is a sub-branch of epidemiology and the preventive cardiology. Then the aim of the study is to estimate the magnitude of different cardiovascular disease, identify the determinants or causes of CVD, and also the underlying mechanisms, and predict the risk CVD for both individual and the population. That is a very important basis for the development of reasonable policy and the CVD prevention and the treatment, as well as the resources allocation. So I know there is the transition of epidemiology from infection disease to the chronic disease to cardiovascular disease is very early in UK and in the many developing country. The developed country is like in England, where you can find a paper published in 1971. It's very early. It's 1940s. The heart disease already become the first cause of the first cause of among the total deaths. And in Japan, the little bit later compared with the UK, then the heart disease, vascular disease become their major issue in the mortality in the 1950s. Then there is a transition theory as a social-economic development. Then your disease pattern will change, evolving like a stroke before. In the poor country, stroke is more than CHD. Then as a social-economic development, you have more coronary heart disease compared with the stroke. And a high proportion hemorrhage stroke in the early stage, then as a development or increase important ischemic stroke. And also, you have a high case fatality. People died from the heart disease, from stroke. When you lower the case fatality because you improve the medical care level, and also the younger age, onset age to the older age. There is a transition theory. Now, actually, China, we really see how the theory is right. We observe the evolving epidemiology transition in China. I mean, epidemiology study for cardiovascular disease started from 1970s in China. Actually, this field start is not from the people in the public health. It starts from clinic doctor. The founder, one of the founder is a leading expert in cardiosurgeon. He actually worked in the countryside in the Cultural Revolution. Then they find that so many farmers have a stroke, have very high blood pressure. Then he recognized as a cardiosurgeon how limited can save people's life. And so he actually, it's very early, is in Chinese, say, epidemiology study and cardiovascular prevention is most important for the people's health in China. And another founder of Chinese epidemiology, cardiology, cardiovascular disease is the leading expert in cardiology, then Dr. Tao Shouqi. Then they also published a very early paper regarding how we should emphasize increase the capacity in epidemiology and also prevention. And the first issue of Chinese Journal of Cardiology, they published in the first issue in 1973, they published a paper is regarding the epidemiology, very preliminary. Then they use 10 years hospitalized data. Then you can recognize the first one is the rheumatic heart disease. And also the patient is the most of the patient is younger than 40, is below 40 years old. And also the pulmonary heart disease is second. The relative few coronary heart disease in that time and very high case fatality for hospital. I think that represents the early stage China pattern. And but in that time, we don't have we don't have a professionals the professional training by for cardiovascular epidemiology. We don't have a team. Then very few international collaboration, and we don't have the capacity, the methodology, how to, and very few very use the right methodology to do the national epidemiology study. So in 1978, the first department of epidemiology was established by the surgeon, cardiosurgeon, and the cardiologist in Fuvai Hospital. Then in 1970, the 4 postgraduate first recruit as their subject is epidemiology cardiovascular disease. One of them is my supervisor, my mentors. So, and also there is the National Network of Epidemiology and Preventive Study was established in 1979 to 1971. Then the first time they used a randomized way to sampling did the hypertension survey in China. And in 1981, the first China-US collaboration on the epidemiology and the preventive cardiology start. Then in 1983, the second department of epidemiology established in my hospital, this Anzhen Hospital. And also in that year, we joined the 10-year WHO Monica project. It's a 10-year project for the epidemiology study. So we have very high quality start that use international collaboration. Then in 1994, then the first time, as the first only developing country, as the only country in Asia, the collaboration with many European countries and the 38 countries in the world, they published a paper regarding the coronary heart disease incidence rate and the stroke. Then the first time we know exactly how low coronary heart disease compared with most other countries. So we know Chinese people have a low coronary heart disease incidence in that time. And also in 1978, we collaborate with many people, many countries, they have a high stroke incidence rate. Then you find China, the men and the women have higher, among those the country with a high incidence, high burden of stroke, China ranked in the first, in the 5 for men and the second for women. So we have very high stroke burden, but much lower for coronary heart disease. Then in this 10-year study, we did the risk factor survey, use the international standardized way, like a lipid measurement all the way. Then we find that during the 10-year, China is a few center with increased risk factor for smoking, for BMI, for cholesterol, for systolic blood pressure in most men and women. And also the 10-year trend you put the total risk score. In China, men is only 3 center have an increased trend during the 10-year period. So we show, but most of Western country, they have the decreased risk factor in the 1983 to 1993 in 10-year period. So, and also we know not only we have a difference, the huge difference with the pattern with the Western country, and in the inside China we have a big geographic difference too. And also we find the transition stroke from hemorrhagic stroke to the ischemic stroke. So it's exactly the characteristic of the epidemiology transition as the socioeconomic development in China. And also in 2004, we published, we work with the Framingham team and trying to evaluate if we use Framingham score, whether or not we can use in Chinese people, then we find it's overestimate. We cannot use the equation. We should develop our own risk predictor score or equation for Chinese people. So those very early study in China. Then currently we have a different evolving feature CVD epidemiology, and also in future. I have been invited to write the epidemiology cardiovascular disease in Asia. Then if you see the Asia, you can divide it according to the social economic the level. Then you find China belong to the second group with very high mortality, high proportion CVD among the total deaths, and relatively high for premature deaths from CVD, and also but a little bit higher life expectancy compared with the people with the relatively low, like Pakistan, Nepal, India. They have an even lower life expectancy and relatively lower social economic development index. But then we compare with three countries with high income: Israel, South Korea, and Japan. Then you find that they have their next stage. Then we can see China will go that 30 years later, we made the same pattern. CVD become less important compared with cancer and also degeneration disease. Currently, the first course, the top course of mortality is dementia. So they're very aging population and very high life expectancy. So population aging and become a very threatened for future for China. And also we see the ASCVD, atherosclerosis-based cardiovascular disease increase substantially, but the hemorrhage stroke keep the same. Even it's a growth rate. It's not age standardized. Still, you see, we actually the increase is ischemic stroke and the coronary heart disease. Then we trying to find why. Why is a risk factor? How is an increased risk factor attribute to the classical risk factor? Now we find actually we work with a team in Columbia University, and then we find that actually population aging and the growth increase CVD by more than 50% in the next 20 years. So population aging is number one, the top course for the increased trend CVD in China. Then the one paper published last year in New England Journal is trying to see the global impact modified risk factor on cardiovascular disease and mortality. Then you can see for the whole, in Asian area, they didn't separate Asian in the country, but in the most population in Asia is from China and India. For CVD, only 59% can be attributed to the risk factor. We know the modified risk factor, and so there is almost half is not. Even we working very hard, still we cannot really control the CVD because the study showing the population aging is already over or is already over the effect that the risk factor control in many countries, including the country in East Asia. So population aging becomes a very threatened for the CVD prevention because we think the age is not modifiable, it's an unmodified risk factor. If you see the population aging in the next 30 years, China currently is I believe it's 14, is now the 11, it's 2020 data, the 2024 is 14, already it's aged population, it's not aging because it's over 14. Then Japan currently is 28. Then in next 30 years become almost 40% is the population is over 65. So if you see the China, what is the most the faster increase the burden is dementia. In 30 years ago, dementia ranked in 28. Currently is in 1917 is 8. Currently is 5 or 4. So I think really we should prepare for that. Then the hypertension, especially the elevated blood pressure, is one important risk factor for the dementia. So even we're still in the stage with a high CVD, but 50% can attribute the population aging. Then I believe that as the social economic developed people have a longer life, that we go to the dementia, the characteristic. So understanding the process biological aging and the impact on cardiovascular health become very urgent. We should know why the biological people aging, what is the major reason for the aging. And currently it's a very hot area with a lot of promising research funding. So if you see actually the biological aging process is start very early in people, then working with elevated CVD risk for the interaction. So that's why I remember one study showing that in the old people, some of the intervention for risk factor is not so effective because the inside biological aging have the impact on the effect of risk factor. So, and also further rise CVD for disadvantaged social, economic, environmental, then is the synthesized effect on the aging-related CVD risk in both individual and population. So I think population aging is a big issue. So if we foresee the CVD epidemics in China in next 10 years, I think the first is the population free for CVD risk factor may increase as the increased health lifestyle and the substantial improve in the availability and accessibility prevention and treatment strategy for CVD prevention, CVD risk factor. The number of survival the coronary heart disease, ischemic stroke, and the patient with heart failure will continue increase as a result of the population aging and also accumulating effect, the risk factor exposure, and improve the secondary prevention and the medical acute rescue of capacity for the patient with acute AMI and acute stroke. Then the coronary heart disease will become a predominant type CVD in China. The proportion CVD deaths in total deaths will decrease. Cancer and degenerative diseases such as dementia will increase in this disease spectrum substantially. The innovation and the non-invasive vessel evaluation and the new technology in early atherosclerosis treatment was inspired emerging a new theoretical frame for cardiovascular health and prevention CVD in the era of long life. Thank you.